And I'm happy to say right now that my research team just submitted a paper with 10 to 15 year results on our first 20 patients with just repair, and it's really shown no arthritis. So, and this is really, that work was based off of Dr. Murray's work, because she was the one who originally showed that in the animal models with using the BEAR, that the only ones that didn't show arthritis, when you compared it to recon or other ways, were the ones who had a repair with the BEAR. So I think there's a lot of interesting preclinical and clinical evidence that's going to make us, that's going to continue us down the road to a lot of benefits, less morbidity, less arthritis. If it happens to fail, you can go revise it, and you can do the reconstruction almost like it was the first time you tore it.